Hi, it's Dr. Krista Waymire with Dragonfly Menopause Care. If you are watching this, you are probably coming to see me in clinic, and I've asked that you review this video so that you can get a little information about what we're going to do at your visit. If you're coming to see me for menopause or perimenopausal care, we're probably going to talk about menopause hormone replacement, which is replacement of our estradiol or estrogen. I use those interchangeably, progesterone, and maybe testosterone. The hormones that I prescribe are bioidentical. This means that your estrogen that I replace with an estradiol patch most commonly is the same molecule as what we measure in the blood when you are pregnant. So for example, when a woman is pregnant, her estradiol levels are in the 15,000 plus range. When you're cycling through your periods, when you're fertile in those years before menopause, you are having an estradiol level around 400 plus. When we replace it with menopause hormone therapy, we're aiming for about 50 to 150 to get your symptoms under control and also to get the benefits of the estradiol, which are specifically, besides symptom control, prevention of heart disease, osteoporosis, and dementia. So estradiol is really the worker bee of hormone replacement therapy. But if you have a uterus and we place you on estradiol patches usually, you need progesterone to balance out the effects of estrogen on your uterus. Estrogen causes the uterine lining to get thicker, to grow, because estrogen is the first hormone in our menstrual cycle where our body is setting us up to get pregnant. So it's building up the uterine lining to make it welcoming to a potentially implanting embryo. So if we only have estrogen without progesterone and we have a uterus, then we will build up the uterine lining from what we refer to as unopposed estrogen. And this creates a slight increased risk of uterine cancer, which is not something that we want to do. So we will put you on at least 100 milligrams of micronized bioidentical progesterone. That is a capsule that you take every day. So the progesterone balances out the estradiol. Now, side effects are rare, but they are something that I see when we start hormones. Sometimes women, even if they haven't had a period for a few years, might have some vaginal bleeding, spotting. That's okay. It's allowed. It's not scary for up to even 6 months. But if you are on it and having heavy periods or heavy period like bleeding, clots, it's lasting for days and days and days, or you're feeling dizzy, something really concerning, a concerning amount of bleeding is going on, I want to know about it. We will probably consider a pelvic ultrasound to look at what's going on in the uterus. Is there a fibroid that we just awakened with hormones, or is there, heaven forbid, a uterine cancer that's developing? So that's something that we keep in mind. But most of my patients have maybe some spotting, if anything, not usually a lot. And some women who are cycling still and having periods on hormones, their periods get lighter. And about a year from starting estrogen and progesterone, most women, the majority of women, stop getting a period at all, which most of us like. Some don't like that, but it's just something to know. Progesterone in and of itself can cause drowsiness, so women like to take it at bedtime, and it's often very good for sleep. So progesterone is a hormone that bathes our GABA receptors, our calming sleep receptors in our brain. Some women can take it at noon and not notice a thing, but a lot of women take it at bedtime, because if you take it, you start to feel dizzy or tired, or almost, I actually feel very kind of woozy on it, so I just go to bed. But if you like that effect because you sleep better on it, we can increase the dose. So I start everyone at about 100 milligrams of progesterone. That's progesterone, to balance out the uterine lining. It's not the worker bee, but it's important. Estrogen, I start women on a patch most often because it gets the levels higher, it's the most affordable, it's easiest to use, insurance covers it the best. And estrogen is dosed at 1 of 5 levels when it's the patch form, and I usually start every woman on level 3, which is a 0.05 milligram patch, and we start there, leave it go for a couple months, see how it goes. Estrogen can cause some breast swelling or tenderness, and that's something that if it's really bothersome, we'll back your dose down by cutting your patch in half for a little while. But if it's going fine, we may just increase it at your follow-up visit, which is usually 2 months from your first visit. So just some basics about estrogen and progesterone. There are some risks of side effects. I've had women have some rare side effects, and to the point where they wanted to stop it. Some symptoms that I don't see very often, not even enough to bring up here because I'm not really, I don't want you to anticipate them, but we can certainly talk if you have any symptoms that are outside of what I'm talking about here. I definitely want to know about it. Testosterone, that's a different day, and I will do a different post for that. But the estrogen and progesterone are the two that we will talk about on your first visit. Also vaginal estrogen, something that will come up because the vagina needs estrogen in a more concentrated strength because there's so darn many estrogen receptors in the vaginal area. So if you're having vaginal dryness, pelvic pain, urinary tract infections, problems down there, I'll recommend a vaginal estrogen tablet twice a week as well. So all of this is just to give you a little bit of a summary of what to expect and just a little knowledge. And I would love for you to seek out Dr. Mary Claire Haver to get some education. She has some great posts and she's on a lot of podcasts because I really want my patients to be educated, to know everything that you can. There's a book called The New Menopause. It's a really helpful starter book for women that are just learning about this menopause business. I want you to be educated. We only have so much time in our visit, and the more you know when you get here, the more effective your visit will be. Anyway, if you have questions, certainly you can reach out to me, but I look forward to meeting you. Have a great day.